Now, 2 o'clock, this will be the Audit Government Efficiency Committee meeting for Tuesday, February 26th. Councilmember Zine, my colleagues, Mr. Rosendahl, Mr. Labange. If they arrive, then we will include them in the meeting. We've got 3 items on the agenda, 1, 2, and 3. And Mr. Clerk, shall we start with number 1, please?
Item number 1, City Controller Report relative to its annual review on the condition of all city funds in the city treasury and review of cash and investment activities June 30th, 2012, in compliance with the California State Government Code and the city's investment policy.
Well, Mr. Simpson in the house. I like the goatee.
How you doing?
Not as gray as mine, though, sir. A little more gray in there.
Good afternoon, sir.
See, he doesn't understand my jokes. Goatee, a little more gray.
Oh, yes.
More gray.
Since the last time.
Okay. Take it away.
Okay, we were contracted by the city to perform this review of the city treasurer's office to make sure that the office was maintaining its funds and investments in accordance with the California State Government Code and the city's investment policy. We perform procedures to give us assurance that this was the case, and this represent our report on the work that we did in that area. The city has about $7.8 billion in investments, and that's indicated in the report.
7.8 billion?
Yeah, 7.8 billion, yes.
Okay.
And our report disclosed that based upon our review, the 7.8 billion investment portfolio was being invested in accordance with the city's policies and also with the California State Government Code. In our prior year, we had 2 findings, recommendations that we made. We looked at the current status of those recommendations, and both of them have been implemented.
So what you're saying is that your review showed that things are in order and the recommendations from previous investigations have been adopted, so we're standing above board with the investment policy and the dollars.
That's correct.
I know there's been a controversy recently about guns and investment in gun manufacturers. Did you go into any of that at all? Where the investments are actually being made, or just the way that they are being managed?
If you have a policy as it related to that, if that was part of your investment policy, we would have looked at it to make sure that that was the case.
Okay.
But if that's not within your investment policy guidelines, then we would not have.
Okay, okay, that's relatively new. That was something after this review. But you've always done stellar work, I got to admit. And the reports come back with honesty and integrity in keeping the departments moving forward in a positive fashion. So we have the Office of the Finance and Treasurer. They're now combined into one.
Yes.
So this would qualify the Finance and Treasury as to one entity where the report shows everything's in order.
That's correct.
Okay.
Yes.
Ma'am?
Yes, yeah. So the, like the investment...
Tell us who you are. Your identity, who you are.
Oh, I am Grace Yun. I'm the field partner on the engagement.
Okay.
And yeah, to answer your question, we did go to the Office of Finance to perform our review procedures.
Okay. Okay. Anyone here from the Controller's Office? No one here? Yeah, there he is. Don't hide. You can come on up. You had your first appearance in council, now your second one in committee.
We have them at the
Spending half your time here in City Hall today. This is good. No, so any comments from the Controller's Office on this? Everything in order? Simpson did obviously another fine report.
Yeah, Simpson has been doing this for several years for us on behalf of Controller, and this report for the first year that we issued, that we have no significant finding, and the previous findings have been properly addressed by Office of Finance. We're pleased with that.
So what you're saying, everything A-OK?
As related to the investment compliance.
$7.8 billion.
Yes, 7.8, yes.
It's a lot of money.
Yes, sir.
Not even close to the national debt, though. $16 trillion.
I don't think.
Maybe we'll get that 7.8 billion up to $1 trillion. That'll be good, huh?
That's not even 0.001% of the national debt.
I know. All right, that's good. So we will note and file, recommendation, note and file on this report. Thank you. Again, good seeing you.
Thank you, too. Nice
Thank you.
seeing you, Mr. Zane.
All right, let's go to number 2.
Item number 2, City Controller reports relative to its audit of the Department of Aging's fiscal and program operations released on December 5th, 2012.
All right. Audit of Department's aging. We're all getting old.
Rick Taguchi, Controller's Office.
Wale Oyewale, Controller's Office.
Well, who's here from aging? Come on up here. Got to face the choir. You guys look too young to be aging.
I'm older than I look.
You're older than you look. Well, that's good. I'm younger than I look. Okay, that's good. All right. All right, take it away.
All right. Good afternoon. Our office issued another report on the Department of Aging Fiscal and Program Operations on December 5th, 2012. The report included 21 recommendations. Just a little bit of a background on the program. The department annually administers approximately $25 million in funds, mostly from federal government, flowing through the California Department of Aging. The Federal Older Americans Act established Area Agency on Aging to locally administer OAA programs. The city is one of 33 AAAs in California. The city is divided into 15 geographic areas called ASA to facilitate the delivery of services to older adults and their caregivers. The department contracts with community-based organizations for service delivery through multi-purpose senior centers, which are designated as community focal points located in each of the 15 ASAs. The primary objective of our audit was to examine the department's sources of funding and how the funds are spent to carry out its mission and objectives. This involved evaluating how the department plans, programs, and spends funds to ensure the effective use of resources to achieve the department's mission. We focused our detailed test work on 3 programs: nutrition program, transportation, and senior community service employment program. These 3 programs combine for about 2/3 of the department's annual funding. In conducting our audit, we interview department management and senior center staff. We review applicable OAA policies and procedures. We also sampled over 160 client case files at 7 senior centers to determine the accuracy of reported client information and the effectiveness of program delivery. We also visited several mail sites and conducted ride-alongs to observe client services and to obtain feedback from clients. We find that the department has adequate fiscal control over the receipt, disbursement, and use of program funds. For example, we noted that funds were appropriately disbursed to providers for specific programs and activities as required, and no inappropriate expenditures were identified. Also, in general, the seniors that we encountered during our ride-alongs and site visits provided positive comments regarding the services that they're receiving from both the department and the providers. However, we noticed some areas where the department can improve in program areas, and here are some of the key findings in the audit. Measuring the effectiveness of outreach to needy seniors. Although OAA is concerned with providing services to all seniors, the intent of OAA is to target and prioritize services to neediest and vulnerable seniors in each planning service area. Although we noted that the department and the providers conduct various outreach presentations targeting minority communities and low-income individuals, the department doesn't track or measure the effectiveness of its efforts to determine the level of services provided to these targeted groups. We believe effective targeting will allow the department to use its limited resources to help those who are at the greatest risk. And those are generally defined by OAA as persons who are poor, minority, or at risk of institutionalization. Another issue that we observe in the audit has to do with the lack of performance accountability for the number of meals served by providers in the contract. The department currently reimburses provider based on actual cost up to contract maximum. The current payment process doesn't penalize providers when they serve less than contracted number of meals. The approach doesn't encourage efficiency and results in different dollar per meal paid to providers. Several other AAAs that we talked to during the audit generally reimbursed their providers based on fixed price per meal. We believe that paying a negotiated fixed price per meal will help increase effectiveness by establishing accountability and will simplify contracting and payment processes. Another issue that was reported has to do with inconsistent eligibility procedures. We noted that the center that the requirement for home delivered meals and transportation programs are not consistent from location to location. For example, of the 7 senior centers that we went to, that we visited, 2 of them required doctor certification as part of the assessment of clients requesting home delivered meals. The other 5 do not. This resulted in individuals in different parts of the city being subjected to different rules of eligibility for the same program. Another item that we mentioned in the report has to do with the timeliness of the contract execution. Provider contracts are not executed timely, and these affect their ability to operate the program effectively. As of mid-September, when we were conducting our field walk, the department had not executed OAA contracts for fiscal year 12-13, which began in July 1st. Thus, the contractor were performing services without an official contract. Providers that we visited expressed concerns and that they had financial difficulties providing services for several months without funding. The cash flow was especially greater for providers with multiple contracts and smaller organizations that do not have a high line of credit to draw on to provide services. Now, we recognize that the timeline for contracting is somewhat out of the department's control. But in order to avoid future service interruptions, our recommendation is for the department to be allowed to execute multi-year agreements with contractors. In the admin code would need to be modified to permit the department to be able to do that. And in its response, the department indicated it's already working with the city attorney and other city officials to make this happen. The department submitted an official action plan, which we've already evaluated, and out of the 21 recommendations in the report, we accepted 3 as being completed and 18 as in progress. And that's how we started.
Okay,
Thank you.
so there were some issues of significance. You're talking a total of approximately $25 million, mostly from the federal government. What happens if the federal government decides to move forward with their stoppage of funds, sequestration? What happens? We have a contingency plan?
If I may,
When it comes to the federal government?
if I may answer that, James Don, Assistant General Manager for the Department of Aging. Based on conversation with our grantor, the California Department of Aging, their current expectations are that if the federal government goes through with a projected about 8% cut to the funds, it probably would not take effect into the next fiscal year for our programs. So
July 1st of 2013?
Yeah, our funding from the state runs on a fiscal year similar to ours from July through June. Of course, the federal government's fiscal year begins October through September. One of the plans that we had in place as a department, in case it were to actually impact our programs this year, was that we received approximately $1 million in one-time only funds that we would use to supplement any program cuts to maintain service levels. Currently, that money is allocated to our agencies to provide either replacement equipment or additional services. However, if the state were to cut our baseline funding, we would basically take that $1 million and apply it against baseline service to maintain. The projected cut almost comes out to like $1.1 million of our current funding. So for the current fiscal year, we should be okay. And as for next fiscal year, we'll have to see what our actual funding award will be for next year and work with our contractors to mitigate whatever impacts there may be. A lot of our contractors have been with us for quite a while, and we're pretty good at working as partners in order to maintain services.
Okay. The problems that occur when it comes to the meals, if they don't serve the proper number, there's
Right.
no reimbursement for that. How do we do that?
That's correct. The main difference between the contracts that we currently have and what the audit report is recommending that we consider is that we execute contracts with a line item budget. So even if an agency were not to serve the meals that we contract with them for, we do not give them all of the money. We only give them enough money to maintain their operations. Part of the reasoning behind that is, regardless of the total number of meals that's served at a site, that agency still has to pay for somebody to be at that site, still has to pay for the utility costs and whatever costs associated with the operation. So we will pay the agency for their actual incurred costs, but we're not giving away any free money if they don't serve the number of meals we contract. And as a matter of fact, because of the demand on the meal services, what we do during the mid-year is that we'll take any unspent dollars due to low performance in one area and then move it to another area of the city where they're actually overperforming and have higher demand. I do want to point out that we have in our report back done an evaluation of using a fixed meal cost, including speaking to LA County about it. And we expressed some of our concerns of switching over. The controller's audit has specified additional condition about instead of using a citywide fixed price to negotiate individual price with each contractor. That's something that we just found out about last week, and we would like more time to look into that. And I'm looking forward to working with Wally on exploring those possibilities to see how we can address any concerns that might come up. One of the concerns that I have is I'm not sure it's legally possible to go out for bid for the same service but different prices with different entities. So what I would do is reach out to general services, their buyers, as well as contract admin, and ask for their expertise in giving us some guidance how it's possible to get something like that done. We will be exploring to see if there's a more cost-effective way of doing it.
Well, one of the concerns I have, it says it shows, report shows served a total of 16,568 meals during 11 and 12, instead of 63,509 as shown on the spreadsheet. And another shows home delivery meals at 16,819 instead of 35,000. So if we're paying for 35,000 and we're only getting 16,000, that's a huge gap. It's like getting double billed.
I mean, are we significantly underreporting the number of meals? According to the audit, it says that we are in year 2011-12.
So it shows 16,568, but 63,509 is shown in the spreadsheet outside CTS. So there's a big disparity there.
I'm sorry. Can I take a look at, I'm sorry, I don't have that copy in front of me.
Bottom line is, how many meals are we providing? And how many are we being charged for? That's all.
We're providing about 1.6 million to 1.7 million meals in total annually. We're not paying for any meals that aren't being served. All the contractors submit to us their report as well as copies of the invoice from the caterers. So we do have accounting of it.
Right here. You could respond to that, my sir. That's a huge difference.
I mean, the chair is pointing out.
Oh, I understand now.
Yeah, help us through that.
No, that particular report, what the audit found is, what they noted is a problem that we're having with our computerized reporting system. Right now, what our contractors have been doing is, there's a double reporting in that they have a computerized system that's not being consistently used. So they all submit a written backup, and that's the discrepancies they're talking about between the written and the computerized. And part of the problem of it, besides the inconsistency, is the timing. They have to submit their computerized reports by a certain time of the month, so the last few days may not always get caught, whereas by the time they do the paper report for the entire month, it does count. So it usually kind of runs a little bit off during the course of the year, but by the end of the year, the numbers should come up together. They should match up by then. So, and Wally can speak up if I'm saying this wrong. Their audit report is not finding that the numbers were double billing. It's just that they're citing a problem with our reporting system. That's the problem.
Okay, well, that's not what it says here, so that's why I want to make sure that we're on.
Right. No, I can understand that concern.
It's like you go to one of the local burger places, you can get 2 chicken sandwiches for the price of 1.
Yeah.
2 for 1, which is a good
That's
deal.
right.
Here it looks like we're paying for 2 and getting a half of 1.
Right. So,
Which obviously $25 million a year, a lot of money.
Yeah.
And since the federal government's having a lot of problems,
Right.
we don't want to abuse that.
Definitely.
So of 19 to 21, it states that recommendation 19 through 21 are considered implemented. The remaining 18 recommendations are considered in
Right.
progress. So is there any dispute with the department saying that the audit was wrong with this or that, and they're objecting? Or are they saying, you're right, and we're going to make the changes?
Well, actually, to give you an additional update, since the report was released, in addition to the 3 that were completed that the controller agrees with when we issued our corrective action plan, we've been able to implement 13 other of the recommendations. We haven't actually reported them as complete because we want to be thorough. We've implemented the changes.
Okay.
But we want to track and make sure that we've actually followed through with our contractors. So we'll probably have everything verified by the end of the fiscal year in June. Most of it we'll be able to verify prior to that, but that's our projection for overall the 13. Of the remaining 4 or 5 recommendations, we're still reviewing those. It's just going to take some time. A number of those remaining recommendations, if we make a change, we have to come back to council to get your approval. For instance, there was a finding about changing our funding formula. What the auditor found was, in order for us to be more in line in terms of targeting minority and low-income seniors, they wanted to make a change. What we want to do is look at it very carefully, because what's going to happen is that it's going to impact about 8 of the council offices, and we're worried about whether or not what the impact will be on vulnerable populations within each of those areas.
Right.
So again, any changes that we plan to make will come back to council as a recommendation for your consideration first.
Okay. When it comes to, are there any matching funds required to receive the dollars from the feds?
Yeah, as a matter of fact, there's a 25% matching share requirement on the city and a 10% matching share on our contractors, except for one program where it's 25% across the board.
Okay, so that's $25 million is the feds. That doesn't include our contribution?
No.
So what's the total of that?
I would say close to about 4 million. We get about 2 million from our agencies as part of their share towards the program, and about $500,000 from the department, which is really city funds. We use mainly salaries and in-kind match, so the city department's related cost applies towards our matching share requirement.
And the controller states the department left approximately $1.5 million in OAA funds unspent in fiscal year 09-10, which were reprogrammed in other jurisdictions. Does the department utilize all funds award it receives?
Right, and I explained that particular year, I don't know if you recall, That was the year there was a problem with the state not passing their budget in a timely fashion.
Right.
And so all of our contractors started reducing their expenditures to maintain staffing. It was near the fall when the council stepped up and loaned us, I believe it was close to $2 million. I think some of it was UDAG money. And so we were able to maintain services without interruption, and as soon as the state passed their budget, we were able to repay the city. I just want to point out that any of the funds that aren't spent does go back to the state at the end of the fiscal year. It gets redirected back to us as one-time only money the following year. So for us, it's been better not to just willy-nilly push our agencies to spend money in the last month of the year, knowing that the money is going to come back and we could spend it more judiciously.
Okay. And how many individuals receive meals and how many meals are served? And did meal recipients report satisfactory with meals they received? So how many individuals receive meals? How many are served? And then were they happy with the service and the meals?
Do you have the report I sent you?
In other words, we have happy customers or not happy?
Oh, yeah. I think I think the audit report found that similar to our own results, they are satisfied with the meals. When we do our own site visits, we do interview the seniors receiving the meals. Most of their comments are good. The only negative comments that we usually get would be something along the lines of there's either like too much fish on the menu or too much chicken on the menu. But we do have customer satisfaction surveys to make sure the menus for our meals are still good. And then every couple of years, we do a telephone survey of all of our home delivered meals clients. And do they include other clients? Is this home delivered meals?
It's just home delivery.
Home delivered meals clients to see if they're satisfied with the services we're getting.
And how much are these folks paying? They're not paying anything. It's all subsidized? Is there any contribution required by the recipient?
No.
Voluntary.
It's all voluntary, and there's a strange
Voluntary pay? Say voluntary.
voluntary donations.
Voluntary donation.
It's a suggested donation.
So if they give a donation, where does that go?
That actually goes towards more meals.
And how much do we collect in donations?
Over $1 million.
So who keeps track of that?
They actually have to report that to us. Under the conditions of the grant, all program income received must be spent first before the actual grant.
So is that in the report someplace? The $1 million that people donate?
I don't know about their audit report, but it's in our fiscal reports that we submit every year to our funder.
So the folks that receive these meals, some of them have the capacity to pay, and then they pay, and we collect over $1 million a year.
Yes, whatever it is that they want, there's a suggested amount, but they could donate as little as they like or as much as they like.
What's the suggested amount?
It varies from service area to service area. Each suggestion is based upon recommendation of their own particular council on aging. That community decides what's appropriate for their particular community. So it'll be higher in some areas, lower in others.
And then has the department reconsidered recommendation number 3 to formally evaluate whether aging should incorporate a fixed price per meal into the future provider contracts as urged by the controller in the January 30th evaluation report?
Yes, that's what I had spoke about earlier. We didn't get that additional caveat about negotiating separate prices instead of one citywide price until just last week. So I will be working with Wally, and like I mentioned earlier, I'll be reaching out to general services buyers and contract admin for their expertise on how I can actually do multiple prices for the same service. I personally just don't know how that can be legally done, but they may have an answer for us.
And then are all methods of program delivery completed in accordance with the requirements of the funding sources? So are all methods of program delivery completed in accordance with the requirements of the funding sources?
Yes. And I just want to say that I appreciated the work of the auditors. Earlier you had asked me if we had disagreements with this audit. We had good, heated discussions, but Wally and Will did work with us as city partners, and that's why we took advantage of the 21 recommendations to try and implement as many of them as possible, as quickly as possible. But we do appreciate the fact that we could have those heated discussions to iron out what's the best for the city.
Then what steps is the department taking in addressing the controller's finding that the department lack of comprehensive tracking system for data collection?
That's one of those that we're in review now. We're looking to see what exists out in the market that matches all of our needs. We have a pretty good system that's already been developed in-house that ties both our program contract and our fiscal together. So what we are looking for is something that could basically do the same thing, if not better, at a lower cost. And that's very important because realistically for the department, we're not really paying for all those programming services we're getting from ITA other than through our cap rates. So if we're going to step forward, we'll also have to identify where we're going to get the money to pay for a new system.
Okay, Mr. Bill.
Yeah, it's been very interesting hearing the discussion, and I really appreciate the work you do at the Department of Aging. But here's the big question. The baby boomers are getting of age. Are there plans within the plans to increase the number of meals considering the number of people that are aging?
As a matter of fact, Laura has been working on an initiative with her counterpart, Cynthia Banks, over at the LA County, to tap into new sources of funds, mainly healthcare dollars. Both the city and county are part of a dual eligible pilot, tapping into Medicare dollars. And part of what they're finding that's being reported from the health plans is that when people are discharged from the hospital, especially seniors, if they don't provide them with adequate support services within the first 2 weeks, and we're talking about meals and transportation services, they oftentimes wind right back in the hospital. And with the new requirements under the feds, the hospitals start getting penalized for that.
Yeah, I know.
It's going to cost them money.
Yeah.
So now they're looking to see what infrastructure already exists that provides transportation, provides meals to vulnerable seniors. Well, the AAAs are infrastructures that already exist. Our concern is that the health plans don't dump their patients onto our programs because we're already serving people. So what they need to do is pay for that additional.
Well, what you have to do is get as close as you can to the Obamacare business, whatever it is. If there are 25 million people who are going to be forced into insurance, which seems to be the case, it is changing the whole dynamic of even those who have insurance. All of us will be impacted by that.
Right.
In the same breath, you need to know what they're talking about in terms of resources for Meals on Wheels. Just for the record, my father delivered meals until he was 85 years old, and then he had 4 years of hell and died in a nursing home. But that motivated him. I've obviously delivered Meals on Wheels every year in my district to the home. And frankly, in my situation with the cancer I have now, I can tell you, having people around you and having meals brought in is a survival thing. And we need to do that. And so you need to get with your counterparts and also talk with the healthcare people. What impact will it have on Meals on Wheels? What will this mean, and what kind of resources will be generated toward us going in the future? Because you're right, the first couple of weeks when you're in a tough situation, if you don't have a support system, you're dead.
Right.
And I was on the verge of death for 4 or 5 months. And if it wasn't for the support systems created around me, fortunately, I could take a loan on my house, which is how I put it together, to finance the support systems that I put in place. It's critical, and the baby boomers are going to be booming out. And they go into that booming out phase, we're going to have to come up with plans and strategies. So I want you to look at that federal program. It's the same thing our chair here and I've talked about regarding police and fire. How does these things impact police and fire? How do they impact the aged situation? How do they impact the resources that we get? So I look forward to that kind of an analysis, but as our chair has pointed out, there are a lot of issues here that need to be focused. I think you did a great audit. I think it's a work in progress, like you're suggesting, and obviously there's more that needs to be done. But you're cooperating. When you said heated discussions, what were you arguing about? 'Cause I'm curious. Was it the definition of who you serve, or the resources, or the federal reimbursement, or what?
It's the passion that comes from people who care the most about the people we're serving, but differ on how they get there in terms of fairness. I mean, for instance, one of the wonderful discussions we had was, are we really serving the most frail of seniors in our home delivered meals program? Well, who is to make that determination that one senior is sicker than the other? There's no way that I would want the city to have that liability. But yet, we still have a responsibility of serving those of us who are the most vulnerable.
Yeah.
So it's those type of heated discussions where we both agree on where we're trying to get. It's just how we're going to get there.
When you said 8 of the council districts are somewhat in jeopardy, explain what you meant by that.
I think it was based on the report from the audit. They identified, and Wally, let me know if I'm wrong, just from my memory, I think there was, if we reconfigured our funding formula, 8 of the council district service areas would experience a reduction in their funding. Basically, the money would just be reallocated to a different part of the city. What we want to do before we come forward to the council for approval to make that change, we just want to see what the impacts are going to be, if it's significant, and what needs to be done if it were. Or, because I believe in our discussions about the change to the funding formula, it's one of those discussions where we both agree on the outcome. It's just how we get there, is how we were going to apply certain factors before or after.
Okay, just one more deep breath question. Go ahead, go for it.
Yeah, I was just going to make a quick
Name for the
comment on
record.
that.
Make your name for the record again.
Wale with City Controller.
Sure.
The issue that we're talking about, I think the recommendation was actually for you to revisit the allocation formula. We're not necessarily asking you to switch to it, but during the audit, we look at the way the state allocate the funding to the different AAAs within the state and compare that to how the city allocates funding to the ASA within the city. And we notice it's not really consistent. And that's what we're discussing in that area, was to look at it to see, if you adopt the state, even though you're not required to adopt the state formula, you can look at it and see whether that works better to target the most needy folks. So we're just asking you to evaluate it, compare it.
And we'll come with a report to council before we make any changes with our recommendations for your consideration.
So how many people, again, as the chair was saying, he said about 4 or 5 times, how many people have we served with a meal right now, as of this moment? Annually.
I wish I had the report. I actually have a report that shows it. I just don't have it with me. We do serve, last fiscal year, we served, of all of our programs, major programs together, just over 300,000 people. As I mentioned earlier, we serve about 1.6 to 1.7 million meals annually.
You're doing one a day? 5 days a week?
5 days a week. We can come up with a
What happens on weekends?
That's the really sad thing. We don't provide services on
You
weekends.
don't provide a meal? What are we supposed to do? Starve until Monday?
We just don't have the funds to provide, and it's always been a
Why don't you
sore point
fight
us.
for 7 days a week, and we'll fight with you with Washington and Sacramento and LA County and everything else. People have to eat
Right.
7 days a week.
So now they get 5 days.
They get 5 days.
You do have a couple of centers that do the weekends. frozen food, but it's not all of them.
Yeah, and it's not under our.
Well, would you look
funding.
into that and how we could do
It-
7 days a week and what resources we need to do 7 days a week? You told us you get $1 million in donations from some of the people. You also mentioned almost $3 to $4 million that the city puts in.
Right, actually, I just recalled there was one thing where we tried to basically seek additional funding for the weekends.
Yeah.
And we were kind of lining up some possible donors. So what we did was we surveyed some of the seniors about, would they like the weekend meals? And the results surprised us. What they told us was, it wasn't so much that they wanted the weekend meals. What they really wanted was more access to fresh fruit and vegetables. And so what fits perfectly with that request is that every summer we get farmers market vouchers from the state, which we distribute to all of the seniors. And that's been a big hit. It's amazing that even though they only provide about $20 worth of purchasing, because we're talking about fresh produce, it just goes a really long way. As a matter of fact, some of the seniors just have issues of trying to be able to eat so much vegetables, fresh vegetables and fruits. But yeah, we will definitely continue looking into additional funds to expand our services to the weekend.
And Mr. Chair, just one more question. Public-private partnerships, which is the direction we need to go. We got a lot of rich folks. I know in the 11th district we do, 5th district we do, Mr. Zine's district we do, some of the others, maybe 4 or 5 districts are significantly impacted with wealthy people. Why can't we do a foundation partnership relationship and get foundation or get money from the super rich to help everybody else? Have we tried an outreach through the mayor's office there with the liaison with the private sector? What have we done in public-private partnership?
The department does have a foundation that it created, and actually the foundation pays for the Thanksgiving Day meals. And actually that was part of the study where they were considering doing it not just for Thanksgiving, but maybe something during the spring, like maybe in April, kind of like the thinking of the Christmas in April type of movement. And actually, I think that was when we ran into that response about we'd rather have fresh fruit than vegetables and an extra weekend meal. But it is something that we will be working on, and we will.
We'd like you to come back with a report on public-private partnership.
Okay.
And see where the mayor's office is on that. And maybe you could tell these mayor candidates they might want to play it out in their politics right now as well. But it's the solution is public-private partnership. And with having a significant amount of wealthy seniors, they all have foundations. They all find ways in which they avoid paying taxes by foundations. Well, let's get them to make that money available for other seniors that could desperately need it. I could see millions of dollars coming from that angle. And I'd like to see a plan presented back to us on how we do a public-private partnership on this.
Okay.
Thank you.
So according to the 2010 census, there are 3.7 million Los Angeles residents, of which 563,000 are age 60 or older. And the age for this participation is 60 or 55?
60 for most of our programs. It depends on the funding source. So for most of our programs, like the nutrition program, it's 60.
All right, 60. And then this represents an increase of 19% since 2000. So from 2000 to 2010, the increase is 19%. We can expect it to continue to grow. As it
Right.
continues to grow, at 563,000, age 60 or older, it's going to go to a higher number. And your department that has 41 positions, $3.8 million budget, needs to figure out how they're going to serve more people. Because the numbers don't seem to be shrinking, the numbers seem to be growing. And a 19% increase into 10 years, that's a pretty good number.
Yes.
And if we can continue with that, because people are living longer and longer and longer due to the great medical facilities and treatments. So we want to note and file this, but we want to report back for Mr. Rosendahl on that issue. Got that, Paul?
Yeah.
Right.
So we can note and file this and have the report come back on the other?
Right, note and file the report, but have a recommendation for them to come back with a report on the lines of a private-public partnership on additional days or foundation to
Serve
seek
7 days a week.
funding for
Yeah.
programs.
Yeah, because it's tough when those people don't get food on those 2 days.
Right.
So I have been joined by my colleague, Mr. Rosendahl. On the first item, we approved that, and we're on the second item. If you want to
Sure.
go for approval on the first, that'll be unanimous.
So moved,
First,
yes.
Mr. Clerk, and then number 2, we'll note in file that's been the direction of the committee, unanimous, and then we'll get that report back. So thank you very much.
Thank you.
And let's move on, folks, to number 3.
Item number 3, City Control Report relative to its audit of the city's mileage reimbursements to city employees and the city's mileage reimbursement program. 2 reports were released by the Controller subsequent to the release of the agenda. Those have not been put into the public record yet.
Who's going to come up and join this fine gentleman at the table?
Just me for right now.
Don't you feel lonely up there? We'll get a volunteer. All right, go ahead.
Again, my name is Rick Taguchi from the Controller's Office. This audit report was issued on December 18th, 2012. The primary objective was to evaluate the city's mileage reimbursement processes and related controls to ensure payments are authorized, accurate, and for legitimate business purposes. Our audit involved reviewing 5 departments: Bureau of Contract Administration, Bureau of Street Services, Building and Safety, Transportation, and Housing. These departments were selected primarily because they either paid the most amount of mileage or they had a high amount paid per employee. And the 5 departments represent about 80% of all mileage payments made citywide. Just in the way of background, employees receive mileage reimbursements at the rate of 55.5 cents per mile for eligible miles, and over the last 3 fiscal years, total mileage reimbursements have averaged about $4.7 million a year. Some of the findings that we had, first of all, departments do not adequately monitor employees' home to headquarters miles. We noted many instances where employees understated these miles. Now, maintaining accurate home to headquarters distances is critical because the number of miles to be reimbursed is calculated based on this figure. And understating the actual home to headquarters distance, which is referred to as the HH deductor, typically results in an employee being reimbursed for excess miles.
They're supposed to deduct the home to work mileage and work to home?
No, that's just it's pretty complicated in terms of the formula. I don't think you want to know. We can go into details later on if we want to go there, but we do have a finding that the reimbursement process is pretty complicated, and we have a recommendation to try to streamline that.
But it should be pretty simple,
Right.
not complicated.
Exactly.
Because when you leave your home, if you're getting mileage from your home to work and work to home, versus when you get to work and then you start when you're doing city activities. I mean, if a person lives in Lancaster, is working in San Pedro, and they're driving 200 miles a day back and forth to work, they shouldn't be getting reimbursement for that. And if they are, then there's something wrong with that. Once they get to work, then the job they do at that particular time, there should be reimbursement. It shouldn't be a complicated system. It should be pretty simple. I got reimbursement when I was with the police union. We would get reimbursement from portal to portal and in call-outs. That's the way they structured it. So
We
it
can
needs
take
to be
a-
a simple process, not a
One
complicated-
example is, let's say a person lives 20 miles from their home to headquarters. If they go from home to headquarters, they get 0 miles. But if they stop at a point that's 1 mile from their house and then go to headquarters, they get 19 miles reimbursed.
Okay?
So
Well, what time does the clock start? That's the key. What time does the clock start? The clock starts at 8 o'clock, then prior to 8 o'clock. Because I can see how that can be abused. And when you're talking 4.649 million miles, you're talking a lot of money.
Really?
And how do you verify that? How do you check that? If a person is saying, did you actually check the odometers, or are you just going by the reports they sent in?
Well, that was part of the problem in the audit. A lot of employees don't indicate where they go. They just indicate they went on inspections, but we don't know what inspections they went on.
So why didn't the department require them to document that? The department be held responsible. I don't want to hold the controller responsible for what the department general manager is supposed to do, but if you've got a mileage vehicle, then that department should have policies in place, and those policies should be enforced. And, for example, the employee shows up at work, you go and you look at the odometer. and then the next day you look at the odometer. I mean, you have to look at every single car every single day, but there should be a checks and balance. And this does not have to be complicated at all. This can be really simple. And if it's not simple, then we need to make it simple. Because that kind of money expenditure is outrageous. And I can understand employees doing the job of doing what they're supposed to do, but some of those people may need city cars, and if a general manager is getting mileage, then why does the general manager need to get mileage? So I've got a real issue with the mileage.
Me too.
And the money that we're spending. And at 55 cents, that's based on the state or the federal standard.
It's the IRS rate.
Okay, that's the federal rate, and that fluctuates.
It changes every year.
So now gas is more expensive than it was before. So this 55 cents would
Yes,
probably
it would go
be going up. So this 4.6 would be 5.6 or 7.6 or...
Correct.
Yeah, this definitely is an issue that needs a lot of revamping and a real simple system, very simple system. So I don't want to interfere with what you're saying, but I got a real problem if it's a complicated system versus a real simple system. And if the odometer's not working, the speedometer's not working, then there's a problem, because then they're guessing. And when you're guessing, it's kind of like you go to Las Vegas and you guess you're going to win, and you come away not winning, you made the wrong guess. Meanwhile, people are being paid reimbursement, and that's coming out of tax dollars that need for other services. Now
Well,
you're
again-
joined by a colleague who's coming to bail you out. Take it away.
Yeah, again, we found that some times the employees don't indicate odometer readings on the mileage claims either, so that's...
Well, then they shouldn't get reimbursed. I mean, if they're not going to comply, there's got to be a verification. You can't just accept that as standard practice and say, okay, this is a world of reality where you have to check. That's why when you leave your house, you lock your door. Most of us do, just to be sure.
Councilmember, you just touched
Name for the record.
Ferret's a private controller's office. The very main issue that we identified as part of our audit was the lack of oversight.
Oversight, that means the general managers of the building and safety, housing, public works, contract administration, Bureau of Street Services, and Department of Transportation, those general managers aren't doing their job, is what you're telling me.
Every department that we went into, we had issue with regard to oversight. And part of that lack of oversight is because of the tedious amount of work is needed to process and oversee this mileage reimbursement. As Mr. DeGucci was saying, it is tedious, it's complex.
How's it tedious and complex? You look at the odometer and you look at what the mileage is, and then you calculate that mileage. It's not tedious. It takes time to go out there and look at the speedometer, the odometer. I mean, I don't understand how we don't have inspections of that for people getting mileage reimbursement. I would question if any of these departments checked any of the odometers, or if they just believe what the report that was turned in.
It is what they believe, what it was turned
Hearing
in
the
by
chair's
employees.
comment, what about those 5 department heads? What have they said to you when you sat with them and did what Mr. Zine just said? They're responsible for this. Do they come up with forms, strategies? Is there any suggestions from these 5 managers?
Well, we have a number of recommendations for them to.
No, not recommendations. I'm talking about what did they actually do to make
Well,
sure.
they have some forms, they have some processes in place, but very much the mileage reimbursement is based on an honor system. They believe generally what employees submit as mileage reimbursement claim
You ever go shopping at Costco?
every weekend.
And what happens when you walk out the Costco
They
door?
check my ticket all the time.
Why are they doing that?
They're looking for unauthorized or, not as something that was processed.
To keep you honest.
That's right.
That's what we need to do.
Exactly. That's what we recommended as part of our recommendation in order to strengthen the controls. And we also have one very main recommendation that just simplify the process and reimburse employees based on mileage they drive, less the mileage from home to headquarters. Simple as it is. Does not require tedious work, would not result in numerous paper filing and location identification, and reimburse employees based on that. It would be simple to implement and would result cost savings to the city too.
What was the response from the department heads to you?
Well, that was a recommendation we had to CAO. That's not up to the department to change. It's a citywide issue. and we are still waiting to receive response from our CAO's office, how they're planning to implement our recommendations.
So it sounds like we need some changes made.
If I could just cue on that one, because he's right, you got to make changes. Can the electronic mileage reimbursement system in place at the Department of Building and Safety, could it be easily implemented in other departments? And does this system make it faster and easier for employees to submit mileage reimbursement requests opposed to the current forms? That's Building and Safety. Have you looked at them?
Building and Safety, they have a good information system in terms of managing the mileage and mileage reimbursement. Not sure whether that system capability can be something that can be shared.
Can you get back with us and see if it does? We'd like an answer on that.
I have representatives from Building and Safety that they may be able to answer.
Yeah,
your question.
well, they're great. Come on up, and if we could...
I love this one.
Chair, yeah.
Transit subsidy, 7 Department of Building and Safety employees who were authorized to receive mileage also paid $5,450 in transit subsidies they were not entitled to receive. What do we do with those people?
There you go.
Give them a nice Christmas gift? $5,450?
We could explain that, sir. My name is Ray Chan, Executive Officer, Building Safety Department. First, let me answer the question from Councilmember Rosendahl related to our electronic timesheets tied to mileage. That system is very effective, no doubt about it. But even that system itself, the auditors, they're very detailed. They also found some areas that we can improve, and we're making improvement on that. In terms of whether that system can be used by other departments, we are more than happy to share the information, our system, with anybody who wants to do that, maybe with the auditor's office, and we're more than happy to help. But it's not up to us to ask other departments to try to use our system, but we're more than happy to offer the system up and also any help that they need in order to implement that. To answer your question, Councilmember Sine, is that that part we already explained to the Controller's Office. So the audit that you see may not include the response that we have. What it is the people, they do get mileage, they also get transit. By city code, that is not a conflict. And if I may explain to you the scenarios that we encounter for the cases that were mentioned in the audit, because some staff, they really park their car right outside the office. They like to take transit from home to work. And for that, they are entitled to the public transit subsidy. And then they will pick up the car because they need the car to do inspection work.
Well, this says that they were not entitled to receive. That's what this says. They weren't entitled to it.
In that part, we make some clarification with the auditors already on that particular issues. The ones that some of our employees, though, that the auditor found out that we receive public transit and also parking subsidy. Now that we resolve the matter. As a matter of fact, based on the auditor's recommendation, we just issue a new policy on driver license, vehicle insurance, mileage, parking placards, and any under overpayment of transportation benefits. We just get issued this one as of today because it took us a long time to put this together. This is very comprehensive. It has been reviewed by the Controller's Office, and we are going to do a lot of tailgate training to our staff. For the mileage issue, we definitely agree with you that we never had enough management control. So this policy indicates that we will have a different brand new mileage form. All the new employees are required to fill the new mileage form by March 18th, and then all the supervisor and manager, we will review their mileage form plus the electronic timesheets. In addition to that, our personnel section will also jump in to help to monitor. And all these is based on the recommendations of the Controller's Office.
Well, what we need is a standard policy for all city employees that are on mileage reimbursement. We need a standard policy for all departments, so it's the same thing. And we need supervisors, because each department has supervisors, need to remove themselves from their chair and their desk and go down and look at the mileage of the vehicle. And I'm not saying every single day, but they need to verify that the numbers there are accurate. because when you're looking at this kind of expenditure, and a person just puts it in, it's okay, nobody cares, and that's the problem throughout the city with a lot of different departments. I'm not showing disrespect to the employees, but clearly, it's the managers that I keep coming back at that aren't doing their job.
Correct.
The employees are getting away with it, not everyone, but enough, because no one's watching. And if no one's watching, it's going to continue. So we need a standard policy for all mileage reimbursement. I don't care what department it is. They only audited 5 departments. There's many other departments. There's 39 departments in the city of Los Angeles, A to Z, aging to zoo. And many of those departments have take-home vehicles. Many of those departments have mileage reimbursement. But we need to have one simple standard policy, and we need the supervisors to do what they're supposed to do. And your department, no disrespect, has had a lot of scandals. You've had probably more than other departments. And this type of situation, if they did 10 departments or 39 departments, it would just compound. So if we take that $4,649,000, that could be 10 or 20 or $30 million in money that doesn't seem to go out. But we can't keep running the ship this way. And that's the frustration I have, is that it shouldn't be complicated. It should be real easy. Supervisors need to do their job, and the general managers need to make sure the supervisors do their job. And there's nothing wrong with one of your building safety inspectors coming in, and the supervisor looks at that odometer and says, okay, this is what it is. This is what your log is. And then check it in 2 weeks and see there it is. I mean, that's pretty simple.
Totally, I agree wholeheartedly, and
And if the
that's
speedometer
why,
doesn't work, then maybe he's not going to get anything back.
no, that's why we agree with you, and that's why, we have this new policy in place.
That's
And we
you. But
believe
what
that-
about housing, public works, contract administration, Bureau of Street Services, and DOT? What about them?
And,
Now,
and
you
you're,
guys are getting.
and you're absolutely right, sir, and we have this policy, we're going to test it, and we're going to improve it, and if any other department would like us to share the information, and maybe we could learn from them, so how we could beef up our policy, I think it's a great idea. If we could work with CAO or the Controller's Office, that would be absolutely fabulous. I think it's a great idea to have a citywide policy instead of just 1 or 2 departments.
Yeah, it doesn't work this way.
Totally.
And today, we just passed in council waste, fraud, and abuse, and holding general managers responsible. They need to report it within 10 days. There's going to be consequences if they don't. When people do things that aren't right, there's a consequence to it, and there's a taxpayer's expense to it all. So while we're struggling as elected officials trying to have money to make sure everybody gets their compensation, we have money that's disappearing, and the controller does an audit, and then we're saying, where's common sense and logic? So again, these are only 5 departments. So have you seen the report that Building Safety has done?
We received it very recently. We haven't looked at it in detail.
Okay.
Actually, there are 2 parts to it. I think we sent in the draft a few weeks ago, along with our initial response, and we get some comments actually from the auditors, and after that, we include those comments, we beef it up, and then we finalize the report, and we just sent it very recently to you. So yes, they didn't have a chance to review the final report, but they did review the initial report.
Yeah, based on our original assessment of the draft, they are addressing many of the issues that we brought up in our report.
Okay.
And I'm sure the final that would be more comprehensive. We just received it, and we will be commenting on it.
Yeah, we just need to make sure that what we put into policy, we enforce.
Yes, sir.
And if we don't enforce it, it doesn't mean anything.
Right.
So what about housing, public works, Bureau of Contract Administration, Street Services, and DOT? Are those representatives here? Time to come up to the seat. Thank you, Ray.
Sure. Can I just say one thing
Sure, go ahead.
before I leave? And this is really from my heart, and I just want to bring attention to somebody whom I really care about this, is I have the opportunity to work with auditors for the past 8 years through many different audits. The auditors are very tough. They're very detail-oriented. They're very focused, and they ask a lot of questions. But at the same time, they'll listen to us so they see the full pictures. I want to let you know that they really have done a very, very good job in doing the auditing. All the recommendations are really, really helpful. They point out the areas that we don't find ourselves, even though we do a lot of reports to measure our performance. I just want to let somebody know that the Controller's Department has a very, very fine audit team, sir.
They do. And what I like to see is that audit come in and say, everything was above board, everything's great, thank you very much, what's the next one? That's what I like to see. Sadly, in this committee, we don't see too much of that. But thank you for what you're doing, Ray.
Yeah, but I just want to make sure we get a report back
But we're not done yet. We're not done.
Okay, because we need to get all the departments together to come up with a simple form that we use. We also need to look at other cities and other agencies and other private sector groups. I mean, I was the private sector most of my life, okay? I joined the government when I was 60, and I ran a cable conglomerate for 22 years. We had simple forms. We made it very clear, rather than confusing and conflicting and misunderstanding or complicated. You know, we're just human beings trying to work at it. So it's a no-brainer that the controller, and that's why the leadership of Mr. Zide is so critical going forward on this, is that we need to have a standard, simple policy. We need to look at everybody doing whatever they're doing out there and come in with a policy that works. It's as simple as that.
Yes.
I'm sorry, Mr. Chair, but I wanted to.
No, that's fine. Okay, Department, sir?
Mr. Chair, John Reamer, Bureau of Contract Administration, General Manager. We agree.
How'd you guys measure up?
Well, I think we did fairly well. There are several recommendations, 13 of which were identified for us, along with other departments, 5 of which were urgent, 7 necessary, and 1 desirable. I will agree with what Building and Safety said with respect to the audit. It was tough. What it uncovered was a lot of things that I found many of the departments were doing the same way, based on our interpretation of the admin code. A specific instance for us as it relates to home to headquarters. And after 30 days, when an employee works at a location for that period of time, their home to headquarters deductor should change. So it can get, as the controller said, involved. I embrace and support a consistent, unified approach to doing this. It should be much simpler than it is right now. I would agree with you. Self-servingly, I would go so far as to say we have a stipend and we eliminate the mileage process. But that is not always practical for some places. Let me speak to my bureau. We have some 250 inspectors. They don't report to one location. They report to the job site. That job site can change on a regular basis. So where they report to begin their day, their supervisor is not there. What we have put in place, and this did come out in the process, was utilizing Google. Now, Google will say that it does not verify the number that you put down there, but we are using it to get a lot closer to being able to monitor exactly what the inspector, the employee, is saying as it relates to their first stop and their last stop. What happens in between stops? That's very challenging. And it does get down to, and I know we don't want to hear this, relying on and trusting our employees. So how we minimize that, check and balance. I'm hearing you loudly and clearly. And that's something that we are doing, making sure that our supervisors are checking. We do have a form that we use to identify the home to headquarters deductor for our employees, their insurance, their driver's license, to make sure that all of that was captured in the audit. Making sure that they're doing everything they should be doing to not only minimize liability and risk on the city, but also to make sure that we are taking care of the resources that the city has given to us. We are stewards of what has been entrusted to us, so we take this very seriously, and I'm sure all the departments do. This has been a good audit, very necessary. We have implemented many of the recommendations. There are several here that we have to work with other departments, one of which would be, should employees use a city vehicle? I'll use our bureau for an example. I would recommend against it, and I'll tell you why. Because you use portal for portal. If we're going to supply a city employee a vehicle, wherever that vehicle is housed, the minute they show up at that location, they start on the clock. Our inspectors have to show up at the job site at 7 o'clock, which means they would more than likely have to go to some location at 6:30, 6 o'clock in the morning to pick up a vehicle, and that's when their time would start. So I'm envisioning mileage would get exchanged for overtime costs. But it's something that does bring into light the importance of us minimizing the number of miles that are driven. So we're also looking into more strategic placement of our employees as it relates to where we assign them to projects, so that they're not driving as far as they do. That can be challenging with inspectors because some inspectors have more expertise than others. So if you have someone that lives in the valley and we need them working at the airport or at San Pedro, that can be challenging because of the expertise that they have. But these are all the things that we're taking into consideration. We have our policy that we're revising in final form. We too will be submitting it to the controller just to take a look at it. We had some concerns as it relates to some of the recommendations and how they would fit with the admin code. And the reason I bring that up is because mileage is a meet and confer issue. So we've been working with the union representing our inspectors. We've had conversation with the CAO. We believe that we're all on the same page now. So again, we embrace, we adopt, and we're moving forward on the recommendations.
Great, thank you. Because I know that serving as a union director for 8 years, the MOUs, the hours, wages, working conditions, and all that. And I trust the vast majority of our city employees are doing it in the proper fashion. But when you look at that expenditure and you look at the possibility of abuse, what you want to do is you want to tighten that up so it's harder and harder to try and do that. And so I use the Costco example.
Yes.
You shop at Costco.
I do.
We all shop at Costco.
Yes, we do.
When I first went in the first time, I said, man, this is kind of interesting. They're checking my receipt. Why are they doing that? Well, obviously, they don't want to have loss of property. That's the bottom line.
Right.
To keep the employees honest, to keep the customers honest, and keep the cost down. I think they're 5% over their cost is what they sell the products for. It's a very popular way to go, and people aren't offended by it. But it's keeping everybody honest, and that's what I'm saying is we need to have one standard policy, and it doesn't matter what department it is. It's got to be, if we're doing portal to portal, if we're not, and whatever variables, but when you have all these departments, 39 departments, everybody's got different policy, then you wonder how you're going to have some consistency. And many times employees go from one department to the other, and if they're using their own car for the purpose versus a city car, it's got to clean up, and we've got to do something to have some consistency. And then hold the departments that have supervisors, because every time something happens, where's the supervisors, where's the supervisors, where's the supervisors? But they need to know the guidelines, so everybody's on the same page.
Agreed.
And that way you don't have these continuing audits that show this was a gap, this was a gap.
Agreed.
Ma'am, your turn.
I'm Wani Jirapat. I'm Chief Accountant at Housing Department.
What department?
Housing Department.
Thank you.
Our report is relatively good, and I'm happy that we had this audit because we worked on a procedure like 3 years ago, and we had to go through negotiating with the union and everything before we can actually implement it. And there are rooms to improve on as the result of the audit. So right now we are working on improving and expanding the procedures, and the chief inspectors are giving us detailed approval procedures. We have a system in Code and Rent called CRIS, where the inspector use the handheld device and go out in audit, and they have, at each stop, they have record of where they inspect the work. And based on that, the system can calculate the mileage from the handheld that is transferred into the server, and we have all the records, the mileage records in the system. So this is only the matter of how the supervisor review the employees' records and approve it. So we are waiting to get this procedure finalized maybe the end of March. And there are another group of people that are on mileage, the rehab construction specialists. They are not on CRIS system. So we are trying to have a similar module so that we'll be able to record the mileage as they go out and inspect the construction site. So we are working on getting the system ready to help in recording all the detail of the mileage. So
How many folks do you have on mileage?
I believe like 180.
180, okay. All right, anything else?
That's all. Yeah, we have minimal findings, but it's good that we have this audit, and I feel, as a departmental chief, I feel very happy that this audit happened, so I can do more in, making sure that their procedures and the compliance with the procedures.
Okay. From the controller, do we know how many citywide we have that are on mileage reimbursement? How many total? 1,000, 2,000, 5,000? Hello?
Yes, I just need to find it real quick. It's in the background section of the report. There's a chart showing,
I'm sorry, we have 1,000, 2,000, 5,000?
I want to say it was like, well, here's right here, okay, on page 17, 1,905.
What's that? 1,000 what?
On page 17 of the report, it shows there's 1,905 employees on average per year receiving mileage.
Okay. And do we have a total of the take-home cars?
No, that wasn't part of this audit.
Okay. Because that would between the police department, the fire department, and all these other departments. So obviously, it's an expensive venture. Okay, so we're talking about 1905. Okay, DOT.
Good afternoon, Robert Dundelon, Department of Transportation. We are, as a department, we're also in agreement with the Controller's Office as far as the findings. We've made some changes as far as the review process and the roles and responsibilities for each of the employees and the supervisors.
How many do you have? How many?
We have approximately, there's 40 listed in the report. There's 33 active on mileage.
Okay.
Approximately two-thirds of them are crossing guards.
Crossing guards?
Crossing guards.
You get mileage reimbursement?
Yes, we do, sir.
For what?
The lead crossing guards are responsible for reviewing the crossing guards at each of the different schools.
Oh, these are the supervisors?
Correct.
Not the crossing guards themselves?
Not the crossing guards themselves, the lead supervisors.
Okay.
Sorry for that. So as we've reduced the number of lead crossing guards, now they've had to cover more schools, so they incur more miles. We've also consolidated vehicles within the Caltrans facility to allow employees to use vehicles within the group itself to minimize the need for people on mileage. We've gone from 40 to approximately 33 now, and we reduced our costs from $150,000 a year to our last quarterly projection of about $108,000 a year. We're also providing quarterly reports to all of the executive officers as far as the number of employees and the mileage they're receiving, and we're also in the process of finalizing our procedures. So if there is a building and safety or another department who the Controller's Office believes is a good process, we'll be happy to follow that process as well.
Okay, yeah, we'll come up with a standard. Okay, that's good. Now, how many parking enforcement cars you have?
I believe it's about 500 and some odd.
That's all?
That's all.
I see them everywhere.
There's about 300 and change are out during the business hours, so that's probably why.
Yeah, no, very present. But that's a whole other story. They're out there doing enforcement, so we're not talking about those. Okay, how about the BOSS, Bureau of Street Services?
Good afternoon, Councilman Dennis Rogers, Chief Management Analyst for the Bureau of Street Services.
How many cars?
Oh, how many people were on mileage?
How many cars? Well, cars, people, same thing.
Yeah, we had about 56 on, and since then, the directors called in all the division heads, and they did a review of each and every person that was on mileage, and they've reduced it down to about 16 or 17 now.
From 56 to 16 or 17? Those people are walking now, huh?
No. Well, unfortunately, as you know, we lost some personnel in the last few years, and they didn't take their trucks, city-issued trucks with them. Primarily, the people that are really on mileage for our bureau are the street use inspectors.
Right.
And that's just how it's always been.
Right.
And they don't have a specific job that they go to. You know, they drive through the whole area. And so those people will probably remain on it. The audit was helpful to us. we've lost a lot of people, and we had a lot of supervisors retire, as everyone did, and it gave us a wake-up call to really remind these new supervisors that people were taking over to come back and they get back into the procedures that we had before. And we've implemented most of them. As a matter of fact, a lot of these are implemented in advance of when we thought we'd have them done, but there's still a couple left to do.
Okay.
One of the things we're very interested in is, and I'm going to bring this up for a reason. One of the recommendations the Controller's Office made is that we have reports out of the system showing us what's going on with the different people that are on mileage. And I think that would be something that would be really nice if we kind of worked on one report that we all did rather than the time of our systems people to each do it individually. I just lost our fiscal person, our fiscal systems specialist, and we're just now getting a new one. You're going to have to catch up. But if we could work together on that report and kind of do a standard out of their system,
that's what we need to do.
We'd be really happy to do that.
Okay, thank you.
Thank you.
Okay, so anything else from the controller? Because we got some recommendations. All right, so here's what we want to do. Okay, so we want a CAO report back on ways to reduce the costs. What we want to do is we want to find a system and a report on the feasibility of establishing a citywide standard mileage reimbursement program. What we need to do is collectively, for all the departments, have a standard form that the employees will be required to fill out and utilize that as the process. Because if 39 departments have 39 different ways of doing it, it doesn't work. It needs to be simple, it needs to be easy, you need to put it on file, maybe put a supervisory checkbox in that they've checked it, how it's documented. So all the audit has shown us is that we have to come up with a better system, and we appreciate that. So we want to have the CAO and the CLA report on the feasibility of establishing a citywide standardized mileage reimbursement program and how we can, ways to reduce the costs. So if we standardize the program, hopefully it'll be a uniform program, universally enforced with all the departments, and then we have one standard process for everybody. And I'm sure if we looked at all the departments, we'd have everybody have a different program. So whatever recommendations the Controller's Office has made, we want to incorporate those, but at the same time, want to come up with a standard, simple form, I should say. And we can talk about some more of the inefficiencies and things, but the bottom line is we need to come up with a new program that works.
If I could just dovetail on the chair's point, if the private sector has a simpler form, look wherever you can look at forms and make that all as part of the report back, because the simpler it is, the easier it is, the more honest, good people will be in compliance. Those that aren't honest, good people, it will point them out as well. That's the key, the standardization. Look, we also know right now that we don't even know as our price is going up at the pump. We know that's all from corporate America there, and it's not from the different government ends, but that's a big deal when people are going to the tank right now. And it also impacts government vehicles when you go to the thing. So the simpler, the better. It's all a no-brainer what the chair is saying, and I obviously support you on this.
And then we need the departments to make sure that they enforce what is the policy, and those forms are then documented. And then when the auditor comes in to check, they'll be able to go in and check. So a supervisor, it would not be inappropriate for a supervisor to see an employee, and let me check your speedometer, let me check your odometer, let me see the numbers, and are they real or not? I mean, that is, to me, very simple to verify. And if the odometer is not the speedometer, the odometer is not working, then there's a problem. So I think it's a pretty simple solution. And Paul, what do you think about that? Because you're going to have to work on this.
I think we'll work very hard on this. We'll assign staff, we'll work with our CAO counterparts and develop something and bring it back to you.
So we want to continue this and bring it back to this committee. You want to note and file it?
With that recommendation.
Send it forward with that recommendation. All right. So is there anyone else who has any comments on this particular situation? How many of you on mileage reimbursement? Anybody on mileage reimbursement? Nobody. Ray, are you on mileage reimbursement? How do you get to work?
I'm not on mileage.
You what?
I am not on mileage.
You get a car?
I get a car.
Okay.
I don't claim mileage.
Oh, but you get a car, though?
I don't, not from the city, that's my own car.
Oh, your own car?
I put my own money, the gas in, and I'm not claiming mileage. I'm totally clean, sir.
Well, how about your boss? Does he get a car?
No, he gets a $500 stipend.
Okay, gets a stipend instead. Can you get the car or the stipend? I said you can get the car or stipend, certain general managers. Yeah, okay, but the price of gasoline today, to fill up a tank at 20 gallons, you're paying $100.
Going through the roof.
You know, it's $100 easy to fill up a tank. It's just unbelievable. And then at 55 cents, it's not really doing it. So some people might say, well, I'll make it up the other way. We've got to be honest with it. And obviously, we have a 5% reserve fund. We found money to put in to have a substantial reserve fund, which means that we're not going to have economic situation, because all of you that are city employees, everybody here is city employee? What happens next Wednesday? No, not next Wednesday, next Tuesday's election. What happens next Wednesday? It's payday. Next Wednesday's payday. You want to make sure you get your paychecks.
We thought you meant that you control this.
Yeah, thank you very much. Thank you very much. No, so what we want to do is make sure that it's done right. We have the funds to take care of the employees doing the job. And those that want to do something that's improper, there'll be measures in place to take care of that. So with that, anything else?
We're done.
So we're done? Mr. Clerk?
And we're done.
We're going to call it an end. Thank you very much. We are done at 3:30. Thank you. Thank you, Bill.
Great. You're welcome.
Here you go.